Exosome treatment for major skin abrasions. Dermatology is among the medical specialties that are beginning to pay more attention to exosome treatment, a relatively new method. Small vesicles called exosomes are secreted by cells and contain a variety of substances, including nucleic acids and proteins, that can affect cellular communication and behavior. Exosome treatment has the potential to facilitate wound healing and tissue regeneration in the setting of skin abrasions. Exosome therapy, with its many benefits for treating major skin abrasions, is a promising development in the area of dermatology overall. Its effectiveness and safety in clinical practice will be further clarified by ongoing studies and clinical trials. Procedure for major skin abrasions. Major skin abrasions can be treated with exosomes by first carefully cleaning the lesion and then applying products containing exosomes. These exosomes support tissue regeneration and repair. A sterile dressing is subsequently applied to the wound. Proper healing is ensured by routine monitoring. It is advised to consult with a healthcare provider for direction and oversight during the course of therapy.